Good morning, everyone. My name is Crystalline, and I'm a nurse clinician, and this is Patty, and she's a social worker, and we are both part of the Manitoba Bleeding Disorders Program. Session 2 will be addressing reproductive health and sexuality. Our first two speakers are Charity Fan and Justin Smaras, who will touch base on the topic of family planning and genetic counseling and fertility. Charity Fan is a certified genetic counselor working at Health Science Centre in Winnipeg. A prairie girl at heart, she is originally from Calgary and obtained her BSc in molecular genetics at the University of Alberta in Edmonton. She did leave the prairies for a few years to obtain her master's degree in genetic counseling at McGill University, before returning to find a new home in Winnipeg in 2015. At work, she focuses on prenatal genetics, but has experience in other fields as well. Outside of work, she enjoys eating good food, watching Jeopardy, and cuddling her rescue dog named Rena. We also have, our next presenter after that will be Justin Smaras, who is unfortunately unable to be with us in person, but has sent a pre-recorded presentation on his patient journey. Justin has an undergraduate degree in cell biology and genetics from the University of British Columbia. He currently works as an embryologist at Olive Fertility Center in Vancouver. Justin is a patient with hemophilia, and in his youth served on the youth committee at the CHS. Now I call upon Charity. Thank you.
Is it this thing? Yeah. Okay. Okay, thank you all for, oh my God, this microphone. Thank you all for inviting me. I'm very pleased to be here. And thank you, Crystalline, for the generous introduction, which I wrote myself. but yeah, my name is Charity. I am a genetic counselor. I work at the big hospital here in Winnipeg at Health Sciences Center. And I've been asked to speak with you guys a little bit about family planning and genetic counseling. But first, I'd like to acknowledge that Health Sciences Center and Shared Health provide services in facilities located on the original lands of Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the national homeland of the Red River Métis. Shared Health respects the First Nation treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We dedicate ourselves to collaborate in partnership with First Nation, Métis, and Inuit people in the spirit of reconciliation. I am a paid employee of Shared Health, which coordinates and administers provincial health services in Manitoba. I have no conflicts of interest to disclose. So I've been asked to speak with you guys a little bit about different tests that people either with hemophilia or could be affected with hemophilia or could be carriers for hemophilia might be introduced to or might be considering throughout their lifespan. So testing may include things like blood work, ultrasounds, genetic testing, and invasive prenatal diagnostic procedures. And we're going to walk through these options by looking at this hypothetical family who has hemophilia A in their family. So we've got Dave here. He is the patriarch of the family, and he has hemophilia A. And that's his spouse beside him, and then his daughter is Erica. And as we know, hemophilia A is an X-linked condition, so that means the gene for hemophilia A is on the X chromosome. And so Dave, he would have the altered gene on his one and only X chromosome, and when he has kids, he would pass on either the X chromosome to his daughters or the Y chromosomes to his sons. And so we know that Erica would be a carrier for hemophilia even if we haven't done genetic testing. Now in this situation, Erica is currently pregnant and she wants to know if she's having a boy or a girl because this affects the chance that the baby would be affected. So how do we answer that question for her? The most common way, and I'm sorry, I'm flipping the paper, so I hope the microphone doesn't pick it up. The most common way that people find out about the baby's sex is through doing an ultrasound. So all pregnant people in Manitoba are recommended to have at least one ultrasound. Usually that's going to be around the 20-week mark, and that's when they take a whole look at the baby's the baby head to toe, and that's when you would often find out about the baby's sex. However, nowadays there's actually another way that we can find out about the baby's sex, even earlier than that. So there is a blood test called non-invasive prenatal test. This can be done for the pregnant person as early as 10 weeks gestation. The test was initially designed to look for genetic conditions like Down syndrome, but it can also check the X and Y chromosomes. So that's how we're able to estimate the baby's gender beforehand at an earlier gestation. And I know we have a cross-Canada audience here, so some provinces do fund this test for people who are carriers of hemophilia, some don't. So if this is something that you guys are interested in learning more about, I highly recommend getting in touch with a local genetic counselor to find out what is and is not available in your province. Okay, so however she finds out that she's having a boy, and she wants him to be tested as soon as he is born. Probably the fastest and most straightforward way is to check the factor VIII activity levels. So I'm sure you guys all know that hemophilia A is when the person doesn't have a high enough factor VIII activity level, and that causes problems in the way that their blood can clot. Factor VIII activity picks up most people who are affected with hemophilia A. And so we don't actually need genetic testing to diagnose this baby. Especially for families where they've long known about this diagnosis, long known about this condition, a lot of these folks maybe haven't ever had genetic testing because it's really not needed for this purpose. But let's say that Erica also has a daughter named Molly, and let's say Molly wants to know if she's going to be a carrier or not. So as we know, Erica has a 50-50 chance of passing on the X chromosome with the altered gene as opposed to the X chromosome with the working gene. And so Molly has that 50-50 chance of being a carrier or not. The problem here is that the factor VIII activity level is not always going to be low for people who are just carriers. So doing factor VIII activity testing can't necessarily tell if somebody is a carrier or not. So what do we do for Molly? And this is where genetic testing would be needed. So just some background information. What I've been calling the hemophilia A gene is actually called F8. And this gene tells your body how to make factor VIII, basically. So if there's a change in the F8 gene, then you don't make the proper factor VIII. And so genetic testing is to look through the F8 gene to see what is the change in that gene that's causing it to not work. However, if, let's say Molly does genetic testing and she has a normal result, the problem is that we can't always tell the difference between, does she have a normal result because she's not a carrier, or does she have a normal result because no testing is perfect and maybe she is a carrier but the test missed it somehow. And so for that reason, we do always want a positive control. So that means we should start the testing in somebody who is either affected or is for sure a carrier before we test people where we're not sure about, such as Molly. And so even though genetic testing wasn't required to diagnose the baby boy or to diagnose Dave, genetic testing may be needed for other people in the family. And so let's say in this situation, Erica, so we know that Erica is for sure a carrier, so she volunteers to do genetic testing to, not because it impacts herself, but to help with her daughter. So Erica has genetic testing and is found to have the gene change in the F8 gene. And then Molly later has testing for the same thing, and let's say it shows that she is a carrier. And now she maybe has questions about what that means. So she wants to know, is there any way to not conceive a child with hemophilia, or is it really just a random thing that we wait and see for? And the answer to that has to do with more of what Justin's going to talk about after me. So there is a procedure called pre-implantation genetic testing, and Justin, being an embryologist, he has a lot of expertise in fertility treatments, and so he will speak a little bit more about that. I wrote on there that linkage is required. What that basically means is that if somebody were wanting to go through PGTM, other people in their family may still need to submit more samples to help the fertility clinic develop the assay for their procedure. Okay. So let's say Molly decides she wants to conceive a pregnancy naturally. Once she's pregnant, and if she knows that the baby's a boy, how do we find out in advance, right? So Erica her mom had chosen not to find out in advance, but maybe Molly decides she wants to find out in advance. So how do we do that? And this is where we talk about something called prenatal diagnosis. And there's lots of different ways to do prenatal diagnosis. The two most common ways would be amniocentesis or chorionic villus sampling. What they have in common is that both ways can diagnose for sure in advance if the baby will or will not have hemophilia, but the downsides is that it can increase the chance of miscarriage in a pregnancy. And different procedures have different timings, like some procedures are done at certain gestation weeks, and others are a bit later or something like that. And some centers offer both procedures, some centers maybe only offer one. So if this is something that people might be interested in learning more about for wherever you live, again, I highly encourage getting in touch with a local genetic counselor just to find out what the options are for you. And so some of you guys may be wondering, gosh, this sounds like a lot of hullabaloo, why would people be thinking about this? And it's different for everybody. For some people, like maybe Molly in this hypothetical situation, maybe they're just looking for ways to, for information to help guide their family planning. Maybe, let's say they don't have a family member that they know about with this condition, so or the only affected person is pretty distant, like they never met this person, so maybe they don't actually know that much about the condition, so they'd like to know ahead of time if the baby has it or not, because maybe they want to take their time and research that condition in advance. There also could be doing these tests may also affect the kind of healthcare that somebody gets. So for instance, people who are carriers for hemophilia have a higher chance of getting bleeding after delivering a baby. So this might be important information for the OBGYN to know. If we know that a baby boy is either affected with hemophilia or they don't know because they haven't tested, then the OBGYN might be careful to avoid using forceps during delivery, or they might have a lower threshold to consider C-section. If, let's say, the baby hasn't been tested prenatally, but the baby is expected to have some planned surgeries coming up, it would be helpful to know at that point whether baby has hemophilia or not, so the surgeons can prepare accordingly. And then finally, there may be some pregnant people who, for whom knowing about a diagnosis in advance may impact whether they decide to either continue or interrupt their pregnancy. So there are lots of different reasons for why some people may want to go through all this stuff that I talked about. There are also lots and lots of people who don't want to do this, and that's fine as well. And there's lots of different reasons. For some people, it's just a lot of stress to think about all these things. It's a lot of discomfort. Maybe they feel guilty about, this genetic condition in their family. Hopefully that's none of you guys. But so there might be personal reasons for why they might choose not to do these tests. Maybe this information from testing doesn't actually affect the way they think about family planning or think about preparing for a baby. So maybe, this information just doesn't really benefit them. Maybe this information is incongruent with their own personal values and belief system. And then finally, as I mentioned earlier, there are pros and cons to these tests. So especially with the prenatal diagnostic testing, there are miscarriage risks associated. So some people just aren't comfortable taking that on. So if they're not comfortable taking that on, then maybe knowing if they're a carrier or not is also not really that helpful, right? So I used hemophilia A as an example, but really all of this applies to hemophilia B as well. We would just be talking about factor 9 instead of factor 8 and the F9 gene instead of the F8 gene. So I've said a few times now, like, oh, speak with your genetic counselor if you want more information. So what is that? So I'm a genetic counselor. A genetic counselor is an allied health professional. We're usually master's trained, and there is a typo in my slide. It should say CBGC, not CCGC. But what that designation means is basically we're board certified by either the Canadian board or the American board. Next. Oh no, too far. Okay, here we go. Yeah, so also another typo, sorry. But basically what our role is to help patients and families understand the nature, inheritance, and implications of genetic conditions. And we help people make informed decisions, and we're non-directive. So what that means is we don't tell people what they should or should not do. We truly, fundamentally believe that the only person who is qualified to make decisions about their own healthcare is that person themselves. And we realize that these are not easy decisions. So when we meet with people, it's really more a conversation about what they think fits best with what they need in that moment. And we don't, we don't, like, how could we dare to presume we know what you're going through? So we don't necessarily recommend that you do anything, but we do help you work through the options. And when is the best time to seek genetic counseling? Really any time. So we see people from all across the lifespan, whether this is prenatal to even the elderly folks. But if we're speaking specifically about reproductive planning, which is our time for today, then really the ideal time would be either before attempting a pregnancy or as early in the pregnancy as possible, just to make sure that all the different options are on the table for that person. And Crystalline mentioned my rescue dog, Rena, so that's her there. That's it.
Yeah. I think we have a couple seconds for questions, if anyone has any questions.
It's not on. Okay. I'm just wondering, when you do the genetic profile, can you predict the level of hemophilia for someone, whether it's going to be severe or moderate, or can you just tell that from genetic testing or not?
It depends on the situation. That's a great question. Sometimes it's really obvious. So if we see that this change in the gene completely, it knocks out the gene completely, then we can tell that that's going to be a severe case. But other times we can't tell because maybe the change in the gene, maybe it's still expected to work, just not as well. So then in that case, it can be really hard to predict what the outcome might be. And we might need to rely on things like, okay, who are the other people in the family who have had hemophilia and what's their condition like, and kind of make our best estimation from that. So a metaphor I like to use is that genes are like recipes. So you've got recipes and you've got lots of different recipes for the same chocolate chip cookie, and they're all fine recipes, but they have slight variations, and that's normal. But then if there's like a spelling mistake, like let's say it says 2 cups of salt instead of 2 cups of sugar, that clearly will not make a good cookie. But then on the other hand, there might be some variations where it's not great, but it still works. It's still a cookie, right? And so that's kind of the situation where like maybe we see a difference and we know that it's going to affect it, but we don't know necessarily to what degree.